Okie dokie, welcome back to MedBites. We're starting a new series called Neuroanatomy Without Crying because I understand how difficult neuroanatomy is, and I've gotten a lot of messages asking me to teach more neuroanatomy. So here you guys go. This is the first part. We're going to go over the brainstem anatomy. So it's important for you guys to know which cranial nerves originate from which part of the brainstem. And this is usually the image that you're going to be given in the exams. And you could be asked to label the cranial nerves, or they'll give you a clinical vignette telling you, the signs and symptoms a patient is having and asking you to label which cranial nerve is the one that's responsible. Now, this image looks confusing, but there's a simple way of remembering these. First, let's go over the normal anatomy of the brainstem. So the brainstem is composed of three parts. We've got the midbrain, which is literally in the middle of the brain. We've got the pons, and we've got the medulla. Now, it's important for you guys to know which cranial nerves originate from where. And for that, we have a famous paper called The Rules of Four that was written by Dr. Peter Gates back in 2005. I'll try and see if I have his social media so to tag him and thank him for his work. But the rules of four basically says that each compartment, so the midbrain, pons, and the medulla, you draw them out, you just make these three boxes, and it says that in each compartment you're gonna have four cranial nerves. Now we know that we've got 12 cranial nerves in total, so let's go over them. We've got O to touch and feel, gives Vinny, PG stuff, all right? So cranial nerve 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, right? So we've got olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossal, vagus, accessory, and hypoglossal. And the rules of four says that in each compartment you're only going to have four. So let's divide these into four. There you go. So we've got three components. Now, it is a rule that cranial nerve 1 and cranial nerve 2, so olfactory and optical, have their own track. They have their own pathway. So if this is optic, here would be olfactory. They don't originate from the brainstem. So we can skip 1 and 2, which leaves us with 3 and 4. So we've got 3 and 4 here. We've got 6, so 5, 7, 8 on the lateral side, 6 in the medial side, and then we've got 12 in the medial side, and then 9, 10, 11 on the lateral side. A general rule to remember about what's in the medial side and what's in the lateral side is that any number that 12 can be divided by is going to be in the medial in the center. So like 12 can be divided by 6 to give you 2, 12 can be divided by 4, and it can be divided by 3 is how we remember the cranial nerves. So this way you can see that we've got the midbrain, we've got the pons, and we've got the medulla. And this way you remember where each cranial nerve originates from.